There we go. Perfect. All right. Well, thank you, everyone. My name is Kyle Peerless, and I work at the California Department of Public Health as a research scientist in the department's occupational health branch. Within my work at CDPH, one of my focuses is on the importance of indoor air quality in preventing the spread of respiratory viruses and improving overall public health. And this focus was developed during our department's response to the COVID-19 pandemic. For this presentation, I'll be discussing the importance of designing buildings with good indoor air quality, or IAQ, for both health and energy efficiency in mind, with a focus on what I see as the challenges and opportunities in this area after spending the last few years doing work in this space in California. And also, before going forward, I want to stress that I'm a public health person and not an expert on more of the policy and energy side. So I'm really interested to be here and hear your feedback on this because I'm not often in forums like this with people with your expertise. So next slide. So my presentation starts with the COVID-19 pandemic, and the pandemic was an event that shined a light on the importance of indoor air because this was a pandemic where the majority of transmission occurred in indoor environments. As such, aside from things like masking, testing, and vaccines, one of the main recommendations coming from public health was to improve ventilation and filtration in public buildings to help reduce transmission. And one thing that I think really symbolized the acknowledgement of IAQ as an essential tool to fight disease transmission was the fact that the Biden administration held an indoor air quality summit in October of 2022 at the White House to highlight the importance of clean indoor air. And in the photo, there's Dr. Ashish Shah, who was the Biden administration's COVID response coordinator, speaking at this event. Next slide. So before we go any further, I want to briefly discuss why IAQ impacts disease spread. So when we exhale, what we exhale is actually, of course, invisible to the naked eye, but it behaves very similar to how cigarette or vape smoke does when it's exhaled by smokers. So if you can imagine a crowded indoor space on the image in the left with poor indoor ventilation, like a bar or something, I think it's pretty easy to imagine what would happen if that room was full of smokers. Very quickly, a smoky haze would build up in the room if there was not good ventilation. And very quickly, every breath taken by people in that room would be partially composed of the smoke that others had just exhaled. If one or a few of those people are sick with a respiratory virus, the risk that others will inhale enough virus to become sick as well is very high. And this dynamic is how super spreader events take place. And so the reason I like to use this analogy is because it also makes it more intuitive for people to think through what we can do in terms of indoor air to help reduce the smoke or virus risk. Next slide. So the methods to do this are shown on this slide. If we wanted to reduce that smoke in that bar, which is the virus, from lingering in the air, we can do really two fundamental things. We can bring in outdoor air to dilute the indoor environment, and we can do this through natural means like opening doors and windows or bringing in outdoor air mechanically through the building's HVAC system. Another thing we could do is physically filter the smoke or virus particles out of the air, which we do by the filtration we use in the building HVAC system or by installing portable air filters. Next slide. So because of this background, during the COVID-19 pandemic, typical guidance from public health agencies would be some version of the following. Buildings should increase the level of outdoor air ventilation that is brought into the building to help dilute that smoke. They should run their system fans continuously. And the reason for that is oftentimes systems are designed to shut off and not bring in more outdoor air or recirculate indoor air if the indoor thermostat temperature is reached. So that's good from a temperature point of view, but in terms of a point of view of the quality of the indoor air in that space, that's not good. So we want to run systems continuously to continue the promotion of recirculation of air. Additionally, we recommended to increase filtration to a rating of MERV 13 or higher. And the MERV rating, if you're not familiar, is a rating of essentially how small particles the filter can filter. The higher the number, the better it can filter things like viruses or harmful elements in wildfire smoke. And then also portable air cleaners. Next slide. So, as a public health professional that was going out into the field and actually making these recommendations, I quickly and my colleagues quickly realized and found that not all buildings in our society have an equal ability to implement these recommendations. Two sectors that we did a lot of response work towards were schools and skilled nursing facilities, for example. And when we discussed with administrators or facility managers about these recommendations, we often encountered resistance. If you look at the stats on the slide, actually the median age of a school building in the United States is 49 years, and the median age of a skilled nursing facility in California is actually 56 years old in terms of the physical building. And if you think about that, in most cases, they had a ventilation system that was maybe renovated once or maybe at most twice since the building was built. So you're talking about very common having ventilation systems that are decades old. And so with an old system like that, things like increasing the outdoor air or running the system continuously would really increase energy costs and strain the system. And so that's why we encountered a lot of resistance to these recommendations. The systems, the facility managers or decision makers felt weren't equipped to actually do the things we were telling them to do. So on the flip side, when we went to school districts that had new or modern buildings, it was very easy for these facilities to make these recommendations, and that many cases they were already doing it. And this had to do with the fact that their newer systems were more equipped to actually implement these changes or were designed to sort of accommodate them in the first place. Next slide. And so the more I did this work with my colleagues, the more I realized that we live in a society that has large inequities in terms of building age and maintenance. And that really contributes to inequities in the indoor air that people in our society experience. Particularly if we looked at building age, like I talked about, this is really significant because there has sort of been a historical trajectory of how building codes and minimum ventilation rates have been developed. In the 1970s, what we saw was a real steep decline in the minimum required outdoor air ventilation in code, and this has a lot of sort of factors that contributed to this, but one of them was the oil embargo of OPEC countries to the United States created real fears about the energy consumption and supply in the United States, and that had a real correlation to dropping minimum ventilation rates to consume less energy for buildings. And so many older buildings in California have HVAC systems that were installed under these earlier iterations of the building codes or building codes that were sort of influenced by this period. And so when systems are designed like this mainly to sort of consume as little energy as possible, when you make health related recommendations to do things like increase outdoor air or use higher levels of filtration, um, the systems oftentimes can't sort of handle these, and as such, doing so will likely increase energy consumption. And so, to summarize things more simply, I think we sort of have a fundamental structural problem where a lot of our building systems are designed for thermal comfort and to consume low levels of energy, but not the health of occupants. Next slide. And we see that there's a lot of sort of challenges in terms of the life cycle of buildings in California. Starting with design, we don't really see that, as I sort of mentioned, that design standards aren't really designed with things like controlling infection risk in mind, for example. Second, there's a really big gap in terms of Title 24 requirements between new and existing buildings. So due to tremendous advancements in building and HVAC design, newer buildings when constructed and renovated are under much better and stringent standards when it comes to things like IAQ and energy efficiency. But older buildings are only required to meet code of the year in which the building was constructed or renovated. So you have this huge gap in the expectation. Lastly, what we found is that there's little to no verification of HVAC performance after a building is either constructed or renovated. So there is good oversight in the construction or renovation, but after it's built, no one really goes back and looks and see how it's functioning. And so this is a really tough problem because there's so many different stakeholders involved and no one really owns IAQ centrally. And so if we're going to solve this issue, it's going to require interdisciplinary collaboration. Next slide. So now I'm just going to close by trying to motivate the importance of this issue and also provide some updates on where we have seen some progress. So a statistic I really like that shows the importance of this is actually the average American spends about 90% of their life indoors. So I'm 32 years old, so I've spent about over 28 years of my life in indoor environments. So the indoor environments we're spending our time in are going to obviously have an outsized influence on our health. There's a ton of peer-reviewed research that shows that good IAQ is not only linked to health benefits like I've described, but also there's real research that suggests it correlates with enhanced productivity and economic benefits. And it's no secret that really big wealthy corporations such as Amazon spend millions of dollars on their corporate sort of building footprints on optimizing indoor air quality because they think it matters in terms of the overall performance of the business. However, our experience at CDPH shows that, particularly in older buildings, healthy indoor air quality and energy efficiency can actually be objectives that are in conflict. And so what I sort of want to put forward is that I don't think we should have to sacrifice health in order to save money or fight the climate crisis in terms of how our buildings design. And so the central problem that we sort of have to solve is how do we design and modernize buildings that have both the health of occupants in mind and also the environment. But to do this, it's going to require really creative interdisciplinary efforts, and it's going to take money to modernize the building stock and ventilation. Next slide. So luckily, we're starting to see some progress. For example, ASHRAE, the American Society for Heating, Refrigeration, and Air Conditioning Engineers, recently published the first ever model standard with proposed ventilation and filtration requirements that are aimed at controlling disease transmission during pandemics. And some local jurisdictions, such as the city of Berkeley, have considered adopting it. In addition, there's federal programs such as the ARPA Breathe program, which is providing $150 million to fund R&D efforts on building ventilation design that is aimed at controlling things like disease transmission, but doing it in the most energy efficient way possible. And then we've seen in California, there's new stricter requirements for things like filtration and carbon dioxide monitoring in schools, which is a result of advocacy coming out of the pandemic. However, there's still much to do, and the main focus, like I've tried to communicate, is really on older existing buildings. Next slide. So with that, thank you so much for your attention. If you have any questions or would like to follow up with me, you can reach out at kyle.peerless@cdph.ca.gov. And then also there's some links on the slide to our sort of indoor air quality page at CDPH where I work. And then also we worked with the UC Davis School of Engineering to make some training videos on indoor air quality on YouTube that are also linked there. So thank you very much for your time and attention.
Right on. Thank you very much, Kyle.